Hello, I'm Dr. Rob Lindsay, and today we're going to start a series of several videos on our diabetes success secrets. And my name is Dr. Rob Lindsay at Vallejo Health and Wellness Center, and what we practice here is what we call neurometabolic practice, or some might call it functional medicine. But we're going to take the next several videos to go through little short 2, 3, 4 minute blurbs. You can watch one video after the next, and I hope that you learn a ton, and it will actually cause you to do something, cause you to take some action. So let's get started here with the first of our diabetes success secret. Number one is this. Diabetes treatment success number one is that you need to know the true blood sugar and blood glucose ranges, okay? So here's the thing. Lab testing ranges are extremely broad. From a medical standpoint, normal blood glucose levels are a broad range of, say, 70 to 105, while functional or optimal blood glucose level ranges are 85 to about 99. So now, according to the American Diabetic Association, a blood sugar level reading of 106 to 126 is called insulin resistance or pre-diabetes, and anything above a reading of 127 is called diabetes. Granted, those are fasting blood glucose levels, and it's important to note that because many times I will see patients who have been tested, and I'll ask them if they've fasted before their test, and they'll say, no. Well, you need to at least fast for 10 to 12 hours, which means no food, no drink, no orange juice, no coffee, anything, just water. Okay? That's all you should have, water, for about 12 hours before your test, so you can get an accurate reading of your blood glucose levels. So, here's the deal. Supporting diabetes nutritionally is futile if your blood sugar level is too high or too low. You just can't do it. A reading below 85 is termed hypoglycemia, and a reading above 99 is termed hyperglycemia. But we can just call it one thing. It's called dysglycemia, and this is the stepping stone to diabetes. Now, diabetes is becoming so prevalent in the United States that authorities are predicting that it may bankrupt our health system. That's not too far away. Hypoglycemia is a condition in which the blood sugar level repeatedly drops too low in response to a high carbohydrate food or meal. Now, refined sugar is a good example of a high carbohydrate food. Now, hypoglycemia can also be a result of going too long without eating. And unfortunately, too many Americans skip breakfast. You can't skip breakfast. If your blood sugar is below 85, it's important that you eat every 2 to 3 hours. You should have breakfast, a snack, lunch, a snack, dinner, and a light snack before bedtime to try to keep your blood sugar levels nice and steady. The snack can be vegetables, fruit, nuts, seeds, but it should be something healthy. Now, insulin resistance, again, is high blood sugar, and it hasn't yet reached the point of diabetes. It's called pre-diabetes, and it's a result of your cells becoming resistant to insulin so that no more glucose can enter the cell in order to make energy. And you need glucose in your cells to make energy. It's a vital, important part of life, and your brain and your nervous system need two things to survive. They need fuel and they need activation. Well, fuel comes from oxygen and it comes from glucose. You see, glucose travels in the bloodstream and until it's turned into triglycerides for fat storage. If you feel sleepy or you crave sugar after eating, well, that's the test. You know that you just ate too many carbohydrates. If you feel sleepy after a low or no carbohydrate meal, you're most likely insulin resistant. Now, it is literally impossible to support hypoglycemia or insulin resistance unless you eat a healthy breakfast with ample high-quality protein. You need to eat protein in the morning, not carbohydrates. You need to eat eggs and or lean meat such as turkey or chicken sausage. You need to eat protein in order to support your blood sugar levels. Even if you feel nauseous first thing in the morning upon waking, eating breakfast is critical, and eating a breakfast of high protein will most likely relieve your nausea. Finally, if you have hypoglycemia, you should never fast. It will make matters much, much worse. So this is the end of our first success secret. If you would like to learn more, please call our office, 952-949-0676. We look forward to seeing you in the next video.